right. So I loved that we did that poll. It sort of gives us a read of the room to know what's going on. Chris, I heard you say not a lot of people are using it from the lingual.
Correct.
That is a game changer for sure. We're not going to talk a lot about that tonight, but we will show some examples of where maybe if you didn't think you had good bone on the buckle, that you could, use these devices to access some lingual bone. So I practice with my husband, Matt Bynum. He's a general dentist. We have 3 kids, Matthew, Luke, and John. We have 2 dogs, Maverick and Goose, all XY chromosome going on except for me. This was our probably our last family vacation that we'll take, because 2 of our kids are locked down with ladies, and a third will be probably getting locked down after college. So this is Matthew. He's our oldest. He's actually skiing the canyons this week, or boarding the canyons this week, I should say. This is Luke. He's our middle son, and he's a D2 at MUSC. He was just home this weekend because this little one right here just turned 21 this weekend and had his first beer. So we were together this weekend. This is Matthew with his fiance, Maddie. This is Luke with his fiance, Faith. And this is John with his fiance, Sal. I mean, not fiance, girlfriend. What am I saying? Good grief. This is what I do when I'm not doing this, is being with these awesome kids. And then this is what I'm doing when I'm not doing those things. I am practicing, and this is my practice. This is Holly Tree Pediatric Dentistry. And my husband, like I said, practices in the same building. And then some of you on here know me because of the Tot Spot. And I teach courses on airway and tongue ties and frenectomies. And I do this in my spare time as well. Fans already coming on, boys, just letting you know. I did zip the file, so I may be able to send it to Jordan. We'll see here. Anyways, so this is my business partner. This is Megan Sharowski. She's a total hoot. She's 2.0 of me. She helps keep the train on the track at all times, except for right now, because she is home on maternity leave with baby number 3. And then this is our team, our amazing team behind us. Obviously, none of this happens in a vacuum. We all work with amazing people all day long to move the needle in our practices. This is Dr. Maria. She's an associate in our practice, amazing human being. Had her first baby, about ready to have her second baby beginning of next year. And this is Dr. Nash, and we let a boy into the club. He's joined us this year. This is his very first day in the practice. It just shows you how well he fits into the culture of what we're doing, taking care of our patients. So just giving you a lay of the land to let you know that I am a wet-fingered, board-certified pediatric dentist. I use these devices every single day in my practice that I'm seeing patients. And so I'm not just, hiding behind the veil here. So how do these devices work? Well, the biggest and the coolest thing is that we're bypassing everything and we're going straight to the apex of the tooth. We're not injecting into the soft tissue. We're not hoping and pretending we're getting near a nerve. We're going straight to the apex, which is the target, which is where the nerve innervates into the apex of the tooth right there. And the other way that these devices work is when we're giving a manual injection. This is where the discomfort happens, is when we're applying the pressure with our thumb. We think we're giving direct pressure, but a lot of times we're not. And every time we give a bump, we're pouring more acid into that tissue, and it's affecting the pH, and it hurts. It hurts our patient. So what's nice about these devices, and there are other devices on the market that do this as well, but nothing on the market does what this device does collectively. But the Soan and the SleeperOne, what they do great is they provide a steady cadence of anesthetic into the tissue and into the bone. So that helps reduce the discomfort that our patients could anticipate or feel. And what benefits are these devices going to provide to the patient? This is one of the biggest ones right here. There is no soft tissue numbness going on. So we don't have to worry about there being collateral numbness and the patient chewing their lip, going to the emergency room, being told they're allergic to anesthetic when we know full well that they're not, that they just chewed on their lip because they didn't know they were doing it. And you will not need to give a block anymore.
Please, Jess. Smoothie.
Making smoothie.
Calendar.
No meetings today. Remember, tandläkaren at 9:30.
Fire off.
Fire off.
Open door.
Door open.
Så ska vi sätta en till.
Ja. Open door.
Wrong voice command.
Open door.
Wrong voice command.
Open. Open door.
Repeat that.
Open door.
I didn't understand that.
Hey, open door.
Play on the floor.
It's on the floor. Open the door. Open the door.
Error.
Here we go. With a rock. Open door. Fire.
Hey, Chris,
Yes.
hold on.
You're muted.
I think I can get it up on the other computer.
Okay.
Can I try?
Let's give it a shot.
Can you see that?
Yep. We can see it. Good to go.
All right, I'm gonna close this.
You're still muted on the other one.
I got it. I
There
got
we
it.
go.
Oh my gosh,
There we
I'm
go.
so excited.
All right.
All right, let me just pop through these slides real quick here. So in this presentation, the slide that I had was this slide because this is more up to date of a slide. This was at Halloween, and this is all 4 doctors, and this is our current team. We're growing. We're adding on to our building, and so we need lots more amazing human beings. All right, so how these devices work, we already talked about this. We are basically bypassing a lot of the anatomy, getting straight to the apex of the tooth. We talked about the cadence of the injection speed. And then this is the big one right here, that our patients aren't chewing on their lips, our assistants aren't getting phone calls after hours. And when we have minimal discomfort, this is how we end up having happy patients. Super important, right? This is how we get the 5-star Google reviews. And then the other thing is these devices don't look like traditional syringes, right? So our patients do not have the typical fear of the needle and the syringe, which is what, you know, they're used to seeing. Adults, in my opinion, are much worse anyways, right? Nobody wants to see that coming at them. No one wants to hear about the mosquito bite or the little pinch that's coming. So what benefits are they going to provide to us as the dentist? One of the biggest things is that, you know, of all the things we do in our profession that we do repetitively over and over, it is giving injections. In my practice, I practiced almost 30 years and I see 10 to 12 operatives a day. And if you did the math on that, and I worked 4 to 5 days a week my whole career, just think of how much tension, pressure, inflammation, you know, we can all be providing to our hands when we're giving these manual injections. Whereas if you look at the picture of the dentist using the Soan right here, it's like a pen grip, and it's so much more gentle. It's more gentle on our tendons and our hands when we're using these devices. And a huge benefit for us as dentists is it numbs our patient immediately. We can, not that I think taking out the premolar on this patient is probably a great idea. However, it numbs the patient immediately. So think of all the scenarios where you've got a B1 patient, a poor behaved patient, a scared patient, a special needs patient, where you have to numb them and then they have to sit there and cook for those 10 minutes for the anesthetic to take effect. Scared, terrified, crying. We're trying to keep them in the chair. We're trying to keep them occupied until the numbness can set in. Imagine, the 2-year-old trauma patient that you can numb and you can get the teeth out immediately, or your special needs kids. I mean, it is just, it provides more compassionate care to our patients and more options to us as doctors. And we can do more efficient treatment planning. We can look at a set of bite wings and say, well, gosh, maybe I can get some more work done today because I'm not worried about, the kid chewing up their lip, or I'm not worried about their tongue being numb. And so you can really see your bite wings with a different set of eyes and decide how you're going to treatment plan differently, more effectively and efficiently for your schedule, but also for your patient. And when the patient is not anxious, the parent's not anxious. And when the parent and the patient are not anxious, we're not anxious, right? Like, that's the worst thing, is when the parent's breathing down our neck because they're afraid their kid's gonna feel the shot or see the shot or be in pain, or we think they're feeling something. So it really does take it down a notch for everybody involved. And this is Dr. Megan working on one of our patients. So in our practice, parents do not come into the treatment rooms. We have this window back here that you can see. And that mom back there, she doesn't give an ish anyway. She's sitting down playing on her phone because she knows her kid's in good hands. But, some parents aren't that way. They're not that trusting yet. And they stand with their nose pressed against that glass watching what's going on. But just here's an example of one of our patients and how compassionate these devices are. Right? Fun getting a shot. So one question I get asked is like, why is this new? Did New Smile come up with this, or where's this like coming from? Why all of a sudden has this been around? And it didn't come into the United States until New Smile, who is a very innovative company, took lots of seized the opportunity and took a big risk and spent a good bit of time and money to get it brought into the United States, and dealt with the FDA and all the nonsense that goes along with that. But all that being said, it launched in the United States in March of 2023. Am I correct on that, Chris? Do I have the right month?
You are, yeah.
Okay, so March of 2023. So, we'll be going on 2 years here shortly that it has been around and been being used. And I'm super proud of us as a profession of pediatric dentists, of how many units have already been sold, and how many offices and how many patients are getting to experience anesthesia with these devices. So where has it been? It's been everywhere but the United States. It's been around for almost 26 years. Intraosseous injections have been given all over the world with different devices, especially with this one. There's over 10,000 practitioners using it and lectures given all around the world. And how it started was with these 5 brilliant dentists at the top here, and they sort of were the center of the web, and then they taught all these people below them, and it sort of has spread out to all these countries that you can see below here. And then all of a sudden it came to the United States in 2023. And it first came with Dr. Andrew Prynne there in the middle, coming and teaching and training Dr. Laree Johnson. And then you think I'm a busy person. Laree's got me beat by 1,000 miles. She's much busier than I am. And so, and as these products started to take off, New Smile realized really quick that they needed to get some more trainers in place. And I was lucky enough to be in the right place at the right time. And I'm super honored to be helping teach this technology to all of you and to my colleagues. So it was Laree and myself for a while, and then it just like blew up, and And New Smile and New Smile Tech are now realizing that they've got to get more boots on the ground to do more of this training. There's just not enough of us. So I'm super honored and proud that my business partner, Megan, has now been brought into the fold. She's an excellent teacher and trainer, and she's going to be giving some of these webinars next year herself, as a matter of fact. And then kabam, right? All these people here, if you don't know their faces, if I had their names under them, you definitely know a lot of their names. These are the people that live on the IPEDO groups. They live in the pediatric Facebook groups. They live on the New Tech Facebook group. They teach about anything and everything that has to do with making pediatric dentistry better for us and our patients. And I'm just super proud to be in this photo with all of these amazing people that are helping us learn and grow together. So Dental High Tech is the name of the company that invented this technology. And then they formed a collaboration with New Smile. And a lot of us know New Smile for a lot of their different products and supplies that they've had available to us through the years. But what New Smile decided to do then was to form a new division called New Smile Tech. And New Smile, so you'll hear like New Smile and New Smile Tech. Well, New Smile is like all of our supplies and products that we all buy anyways. And then New Smile Tech is the division of New Smile that's doing the anesthesia devices. If you haven't been on one of Casey's webinars yet, talking about the new scanner that's out, that will fall under the division and teaching and training of New Smile Tech. So it's very exciting to see New Smile branch out and say, hey, what's some technology that we can make available to our customers as well? And that's where we come in. So dental equipment has definitely evolved through the years. I mean, it used to look all ratchy and over here on this side, and it's definitely more streamlined and modern today. And then the problem is that the syringe has never changed. It's just always been the syringe. It just always has looked like this. So when these devices come out and look like this, it is like eye-catching, right? It's like the shiny new thing. It's like the new car. And we're going to unpack these devices tonight and kind of talk about what is different about them compared to a traditional syringe, but also what is different about them from one to the other. Also, where do you get one of these? I already brought it up, but basically New Smile. This is a direct product. This isn't a product you're buying from Atlanta Dental or Henry Schein. It is proprietary to New Smile. So the people you see on your screen, Chris, Aaron, and Jordan, those are your people. Those are the people you're going to call, you're going to text, you're going to email, you're going to do something, and you're going to get one of these in your hands with these wonderful people on this webinar tonight through New Smile and New Smile Tech. And like I was saying, New Smile, these are the products that, I mean, I would imagine everybody on this webinar tonight has had at least one of these products in their hands through the years. New Smile's been around since 1991. They were one of the first to bring the all white crown, if you will, to market. And they just keep continuing to push the envelope and make things better for us and better for our patients. And I'm just, I'm really proud to be a part of that, to be honest. So what do they look like? This is what they look like. And I'm going to go back to that slide. Kind of the biggest difference I want you to recognize on this slide is that the one has a cord, the SleeperOne has a cord, and the Soan does not have a cord. The second big difference on this slide I want you to appreciate is the SleeperOne has a round blue light that goes all the way around it. And the Soan has a string of lights that is only on one side of it, of the device. So the real differences are shown here. The Soan is wireless, it's cordless, it's portable, whereas the SleeperOne 5, is on a cord, it is wired. The Soan has 2-speed settings for delivery. We're not going to unpack all that tonight. It's like a little mini computer. That's what Aaron is there for, is to train you on these devices once you purchase them. The SleeperOne 5 is less expensive. I guess that's the technology in it. Maybe isn't as much to come up with, but it is a less expensive device, and there are 3 speed settings for delivery. And really the only other difference, and you would never know this unless you were holding both devices or both containers in your hand at the same time, but the little clear container or canister that the local anesthetic sits in, those are different sizes. So you would know right away if you were screwing the wrong one onto the wrong device. But I will tell you that if you're on the fence about getting one of these devices and you're not sure you're even going to unpack it, maybe go with the SleeperOne 5. Maybe go with the one that plugs in. You have to decide what you like. I like the Soan. I want something that is portable. I want something I can take from room to room. I don't like cords, but there are a lot of people who have the SleeperOne 5 and love it. One thing that always gets asked on these calls is, does one weigh more than the other? And I think it's the Soan that weighs a little bit more than the SleeperOne 5, but I don't think it's anything that's noticeable when you have it in your hand. So again, this is what the canisters look like, or containers look like, that house the carpula of anesthetic. And each canister costs around $20, $25, something like that. Be very clear to the people on your team that these are not disposable materials. These need to be used and reused over and over again. And they do have a lifespan. New Smile Tech will tell you they have a lifespan up to 50 steri cycles, but you can push the limit on that. That's just all they're telling you, that their studies have shown that they can come to you and say is good to use. But I've had the devices going on a year, and we haven't ordered any except for the first batch that my sterilization tech threw away. So we're plugging along. We haven't really had much breakdown of the canisters. It's clear. The new canister is clear. It's got a slight blue tint to it. And then over time, they are going to show this like haziness, and they're going to get the cracking on there. And the cracking that you see does not mean throw the canister out. Throw the canister out when it looks like it has been drugged behind a semi truck. You can use these for a very, very long time. And I'm bringing this up on tonight's webinar because in the Facebook, on iPedo and in the Soan Facebook group, it has gotten some traction here this last week. And I would like, Chris, if you would sort of speak to this, give people on the call tonight some confidence that this is like, we're good. These canisters are good.
Yeah, I mean, again, they are IFU warranty for 50 sterilization cycles. We've had a few instances where they've kind of failed prematurely. It can happen. Like I said, it's just a few cases, so it's not very common at all. If that does happen, just reach out to one of us. Happy to replace them again under warranty, free of charge. Don't need anything happening to those containers or to the devices or to your patients. So very, very happy to replace those.
Great. Thank you for commenting on that. So stop talking and just freaking show me how these devices work. Show me like how it goes into somebody's mouth. So the significance of the delivery speed, this would be like a normal, given a normal injection, you put it into the tissue and the anesthetic just disperses and goes everywhere because we're not controlling the speed. So we can't keep that bubble of epinephrine and anesthetic in place. Whereas when we're using these electronically controlled devices, it's going to provide the anesthesia at a cadence. It's going to hold it intact. It's going to give time for the epinephrine to work and to contract those vessels and keep the anesthetic in the area that we want it. So there's going to be 2 injections. The first injection is going to go into the papilla, where you're going to want to deliver the intraosseous portion of the injection. That's the first one. We're just numbing the tissue. That's it. Second injection is going to come in at a completely different angle and go in between the teeth. And if we pretend like we're looking in there, we're popping through that cancellous bone. Then we're putting our foot on the pedal again, and we're injecting the anesthetic in there. This is probably going to get asked at the end, so I'm going to bring it up now. People worried about where these needles are going. Are they all crashing into the PDL? Are we destroying tooth buds? Are we, what is going on? And I will say we all are pediatric dentists. We have all sat in lecture after lecture, taking exam after exam on dental anatomy. So it does take pulling out from the back of your brain all this dental anatomy stuff and remembering where our root structure is, how things are angulated, and or you will be brushing up against a PDL. So having your angulation down is important, but if you stick to what you know about anatomy, you're going to be fine. So when we're giving an injection in the maxilla, we can, with these devices, we confidently know that the anesthetic will flow 2 teeth back and 2 teeth forward. When we're giving anesthetic in the mandible, we confidently know that the anesthetic will flow 1 tooth distal and 2 teeth forward. Now let's think about this. We've got a 4-year-old kid with very porous bone, probably can push those limits, right? We've got a 12-year-old kid that's trying out for the football team, probably going to stick with that 2 teeth forward, 2 teeth back, and 1 teeth back, 2 teeth forward mantra for that kid, right? So as you pick up the device and start using it, you'll learn what what limits you feel you can push. But in the maxilla, 2 back, 2 forward, and the mandible, 1 back, 2 forward. Just kind of keep that as a little formula in your head when you're delivering anesthesia and you're picking your site of delivery. So again, keeping with that rule, if we're injecting right here in the mandible, we know we're going to get anesthesia profoundly, 1 tooth back and 2 teeth forward. If we go in the front, if we're going to the anterior, we're going to cover the whole thing. We get cuspid to cuspid in the anterior. And same thing, you can see the vasoconstriction. You can see the white tissue right there. And in the mandible, we can even get a little bit further because that bone's a little more porous. So just showing you like what you can do with these devices. Why is there minimal, if any, discomfort? We're going to use a special needle. We're going to inject electronically, and we're going to make sure that we've got our support points and ergonomics and our dental anatomy and everything down perfectly when we're using these devices. So what is this special needle? This is what a normal needle looks like. And it literally has no cutting potential. It literally rips the tissue, which is what you're seeing there on that SEM. Whereas when we talk about these proprietary needles, these Effitech needles that you purchase and use with these devices, it's a double bevel, and it almost has like a scalpel effect, and it literally like just butters into the tissue, if you will. And this is basically what we're doing. We're using that needle, we're holding it at the right angle, we're going in about 15 degrees. Don't lose sleep over 15 degrees. You're literally just laying into the tissue right there. And because it is a scalpel edge needle, it just like, I don't even know how to say it. It just like disappears into that tissue. And we are trying to, you're not trying to go down to bone. You're trying to stay within that mucosal gap right there. And if we're talking about the difference in the needles right here, again, the Effitech is double beveled. The traditional needle is tri-beveled. It's going to puncture and tear the tissue. They do come in different sizes. These are all the different sizes on here. And then at the end, I put the cost on here. And the cost is about 10 cents more per needle to use these needles than a traditional needle. So even if you were using a traditional syringe, these needles would be more compassionate to use with your patients. So it's a 3-stage technique. We already kind of talked about that. First injection is going to go into the papilla or into the mucosa. The second, and we're going to come out with that. We're going to rinse the mouth and we're going to go back in. And the second injection is the IO injection. We're going to penetrate through the bone and then we're going to deliver and dump the big load of anesthetic in at that point. So this is how slow the anesthetic is going to come out when we're giving that mucosal injection. It's nice and slow, so it's not creating any discomfort. It's not bubbling up the tissue quickly. And another important thing is that these needles, these Effitech needles, have the letter D printed on the side of them. And that D needs to be facing out. It needs to be facing the buccal side because that's telling you the orientation of that double bevel, that scalpel effect on your needle. So you can see right here, we've got to have the D pointing out. This is just photos showing that and how that the clinician is just sort of laying the needle into the tissue. Here's an example. We're just going to lay it into the tissue. And you're keeping it in there. I mean, really, you're just watching for that tissue to blanch. You're keeping it in there about 5 to 10 seconds, I would probably say. This is in our office. This is Dr. Nash and myself doing step 1 of this injection. And you can see the D's facing out. He's literally just like laying and pushing it in until he sees it go underneath. And this one's mine. Back here in the back. And here I want you to appreciate, you're going to see the needle flex. People all worked up about the needle. Yeah, the needle flexes. It's fine. I'm not pushing on it so hard that I'm, bending it to the point of no return. So the second part is going through the bone and then delivering the anesthetic. So this is showing the speed of the anesthetic going in when we're doing the IO part. It is going faster, but when you're watching that and you're watching that plunger, it feels like paint is drying. It is so painful to watch it. And I just sit there and go, it's going to be one full song from Moana before this goes in. I know that's about how long it's going to take. So again, we're going to show some examples of this second injection. Completely different angle, right? We're coming from above, we're pushing through that cancellous bone. And I want you to appreciate how Dr. Marina has her hands. I call it being choked up. It's like being choked up on a baseball bat. You're choking up on this device. You're very close. You have way more tactile sense the closer you are to the site of delivery. This is a great slide. I love this slide. I love seeing this in all the lectures because it's letting you know that when you are pushing that needle into the bone, oftentimes you're going to get the sensation of a pop or a feeling of going through an eggshell or the feeling of going through like a Capri Sun or a milk carton. But this is not the litmus test. If you don't get that pop sound or that pop feel in your hand, that does not mean that you are not in bone. But if you do get it, as a home run, you're there. That's a Yahtzee. This is not the greatest video, but I've got it in here because this is me. This is me getting a tooth worked on. Even though these devices are only for kids, what is it, 12 and under, right? That's what they're supposed to be used on?
14.
14 and under, but I'm like a kid and I have porous bone, I guess, and I wanted it used on me. Matt was doing a crown on me and I wanted to have I wanted to be numbed this way. So this is Dr. Megan giving me anesthetic. And the reason I'm showing you this is you are going to watch the needle pop through the bone, but me as the patient, I can feel it. It's not a bad feeling, but in my head, I have this sensation of it happening. So your patients will experience that as well. She's working, she's twisting. This part, I don't feel any of it. Like, I don't know any of it, but watch here. She's going to pop in here in just a sec. Pop. And she even said it. She's like, wow, we're there. Then she puts her foot on the pedal and she starts delivering anesthetic at that point. Pretty cool, pretty cool. This is going to be giving those intraosseous injections right here. Again, this is Dr. Nash. He's the first injection's already been given. So he's going in. You see he's choked up really high on the device and he's twisting. He's being patient. And he's sort of pulling back to see if he's in there. And he feels confident that he's in there. And he's giving his anesthetic. We're showing you here the dots on the device. If those dots start to go up too high, that means you've got too much back pressure. So you're always kind of watching those dots right there. This is yours truly going in for the intraosseous portion. And see, I'm tugging back on it. I'm like, I'm not really sure I'm in. I'm going to twist a little bit more. And I'm going to tug back a little bit to make sure I feel that I'm in the bone before I start my injection. Are radiographs important? This was a learning curve for me. I don't pull out radiographs before I pull out my syringe, right? Like that's not something we routinely do. Radiographs are extremely important when we're using these devices. So here's an example. Here's a pano. We are going to work on 19K and L, but boy, we don't have a lot of bone. How are we going to give an intraosseous injection if we don't have anything osseous to go into, right? But we got to think, we do have bone. We have bone distal to K. We can go in between 19 and K, and that can be our sweet spot because we know we're going to get profound anesthesia, 1 tooth back and 2 teeth forward. So we can do the restorative on 19, and we can take out K and L with one injection site. Here's another situation doing the reverse of that. You're looking at this and you're like, oh man, I don't have any bone between those 2 molars right there. But then if you pull out the pano, you do. It's just the angulation is different from your bite wing to your pano. So you do have good bone there between those teeth. Here's some other examples when you're trying to like treatment plan and think, where am I going to go? There's some good bone. Here's some bone right here. And this is the one we just showed before. Here's some good bone right here as well. Just showing right here where you would, again, want to go. And just think about this. On this kid, you can get all this dentistry done in one visit. You could do both those quadrants and do whatever it is that, you know, you treatment plan for that patient. Here's an example showing given an injection between K and L. And again, it part of this learning curve is like how much anesthetic to give, right? Okay, so if I'm doing an occlusal or if I'm doing an MO or a DO, I'm maybe going to give a quarter carpule. But if I'm doing a big girl like this big pulp and crown right here, I'm to feel better and more confident, maybe a half a carpule to 3/4 of a carpule to get that done. Same thing. And this is the case. This is the finished case right here, the same kid. Here's some anterior work we're going to do. I would agree with this. Probably half a carpule would be what I would want to use before I'm going to treat these teeth. The other nice thing is it really creates nice hemostasis. You have very minimal bleeding of your tissue, whether you're doing an extraction or you're doing preps. I mean, this looks really nice. They probably didn't have to pull out any, you know, viscostat or anything to control much of that heme right there. Here again, this is an MO and a DO. Probably a quarter carpule would have got the job done here, but a half a carpule is fine as well. This is me, this is my patient, and I'm just showing you here that like I got to find some good bone here, and I chose to go between A and B right here. That's a lie. I'm going between B and C right here. And the super cool part, I know when we make these videos, we want to show y'all like what we're doing and how we're holding the device and how it's getting numb. But if we could just make a video roll of all the kids' faces, they don't care. They don't move. It's like, it just completely changes the behavior of the patients. Not my patients. This is Dr. Lorianne's patient, but I put this video in here because this is a super hot tooth that they're going to get out. And I love this video because they're going to do the numbing, and then she's going to take some instrument and she's going to go straight on the lingual of this tooth. After she's done here, she's doing step 2. She got into the bone. She's obviously looked at her radiograph. She knows what's up. And after she's done numbing here, she's gonna elevate from the lingual. Buckle in the lingual immediately and get this tooth out. So people are concerned that you're not going to get profound anesthetic on the lingual. You are going to get profound anesthetic on the lingual every single time. This is Dr. Megan working on a patient, just showing you do have to learn the positions and how to hold these devices because you're going in at completely different angles than you would with a traditional device. This is a good video to show the little girl. I mean, you can see her eye right there. She doesn't care. Like the nitrous blowing in her eye is probably bothering her more than anything else. This is another patient. This is an anterior case. Just showing you we're going to lay into the tissue in between those papilla right there. Give the stage 1 injection. What a great case, right? You do stage 1, then you go in and you do your IO, then you literally pick up your rongeur, take out those 4 teeth or whatever, you know, if all you're doing is taking out those 4 front teeth, you're done in, I mean, you're done in like less than 5 minutes. It's worth not changing your gloves to go check a recall if you could do this and get this kid out of there that quickly, right? So again, just showing you why it works so well. It's the cadence of the anesthetic that we're delivering. You know, making sure that we're doing this safely. One thing that is very different with these devices is we call it the circle of safety. So you're sitting very close to your patients. Their head is, and this isn't like weird for us for pediatric dentists. We're used to, you know, we're waiting for the goat rodeo to start. So we've got our patients super close to us anyways, like sort of caged in, right? So we're used to being very close, but you are sitting very close to your patients. The ergonomics are a good bit different using these devices, but we're going to show some photos of that here in a little bit. So wrapping things up, let's talk about anesthetic. Anesthetic is immediate. One thing that's going to be a big shift for you is you're going to put your lidocaine away. Where anytime you're giving an intraosseous injection, we're talking about using septicaine, articaine. It's the exact same thing. Septo and arto are the same exact thing. And we really want to stick with the 1 to 200. The 1 to 200 is going to give us a working time of 30 to 45 minutes, which most of us on this call should be able to get a op done in 30 to 45 minutes. If you've got a longer or bigger op, you're doing some hypoplastic teeth or some stainless steel crowns or whatever. If you do need longer working time, I would encourage you to pull out the 1 to 100 septicaine instead. It is going to give you a longer working time. The difference is that the 1 to 100 does have a higher chance of causing an ischemic reaction to the tissue. That's all septicaine that's 1 to 100 can do that. So it's not the device doing that. It's the septicaine itself. So we like to stick with the 1 to 200. And the other thing is I don't want all these carpules sitting in the drawer. I want my team to know, hey, when I'm confident when I pull this carpule out of the drawer, this is what she uses. This is what we all use. It's not like, oh, shoot, I loaded the wrong thing. It got in the wrong bin. No, everything is 1 to 200. And if I need longer working time than 30 to 45 minutes, I'll inject again. So I just encourage you to, you know, just keep it simple, stupid, right? So the 4 key principles: use the most appropriate anesthetic solution, which we just said is septicaine. Make sure you inject the right quantity depending on how much work you're going to be doing. Be gentle and take your time. Be very patient and inject close to the target. The closer you get to the target, the less anesthetic you have to use. Don't come on here and talk to me about articaine or septicaine in kids under age 4. It's completely within the standard of care to use it. Malamed is, you know, the GOAT on this. He's got study after study supporting that anesthetic septicaine in kids under age 4 is completely safe and able to be used. And we're not using, if you read these studies, we're not using these doses they're talking about anyways. So what else am I not asking about or thinking about? One thing, is there anything else like this on the market? There are things that are like it, but there is nothing exactly like it that does all the things. So if you think you're going to go on Alibaba or some other janky website and buy something, not that the woodpecker sold on there, I'm just saying if you think you're going to go somewhere and try to buy something, it's going to be subpar. It's not going to, and the price point on these is so good, y'all. We're going to talk about that in a minute. There's no reason to try to save a couple $100. I'm just telling you, there's not. So these are the different things. Some of us on this call have maybe played around with the Stabident or the wand. Some of you maybe had your hands on the wand in residency. none of these do, you'll get yeses and nos, but you're not going to get yes all the way across, except with the Soan and the SleeperOne. Hypoplastic 6s, if you're thinking about getting these devices for nothing else, a hypoplastic 6, it numbs it immediately. I used to be nervous when I went in and it said like 19 occlusal. I mean, 19 occlusal can be like a, preventive resin, or 19 occlusal can be like a bomb that's hypoplastic, right? I don't even worry. I walk in the room now and I'm like, I've got this. I know I don't have to give 58 injections. I don't have to try a bunch of different types of anesthetic. You're going to get it every single time. You're going to numb these hypo teeth. Studies show that local infiltration for hypotooth, you're going to get it about 25% of the time. And with an intraosseous anesthetic, you'll get it 88, almost 90% of the time. That's just intraosseous. That's not even talking about these devices. Add these devices on top of it and you're going to hit the target. Do I need to use topical? That is a personal decision. In my opinion, I like to use topical. I like to at least stick a Q-tip in their mouth so I can see what I'm dealing with. If I stick a Q-tip in their mouth and they're acting a fool, they're going to act a fool the entire visit, no matter what goes in their mouth before or after. So, you don't have to use topical, but maybe at least put a Q-tip or something in there so you can see what kind of reaction you're going to get from your patient. But as far as, do you have to use topical before you place that Evotech needle in there? You don't. They really don't feel it. Patients don't feel it. What size needle should I use? It's going to come with 2 different sizes. I'm going to tell you to just stick with the extra short. I've only ever used extra short needles my whole career, so this was not a big change for me. But you're going to have much less chance bending a needle when it's an extra short, because it's not as long of a distance that is traveling when you're trying to maneuver these devices. We kind of already talked about this. How much anesthetic should you give? It's really going to depend on the size and the dental age of the patient. How many teeth are you needing to work on? What are you going to be doing on those teeth? And how much time do you need to get that job done? You might love to give palatals and blocks, but you really will never need to do that again if you buy these devices. That goes out the window. There is a learning curve. The best thing that we can all tell you, all the teachers and trainers and colleagues that are using these devices, is start with primary teeth, start with baby teeth, start with a good 4-year-old, and better yet, if you can start on a kid under general anesthesia or IV sedation and practice on those patients. And don't say, oh, well, gosh, that's being mean. You're giving them anesthetic when they don't need it. Well, it's going to help with your hemostasis. If you're prepping the teeth or you're doing some extractions, it'll help that way. So if you have a sleeping kid, that's a great patient to practice on, but I would encourage you to start in the primary dentition. Bending needles, it's going to happen. I had somebody shadowing me a couple weeks ago and I bent a freaking needle right in front of them. And I was like, well, here it is. Here it happened right here. All you do, you just keep needles handy. You take the needle off and you put a new needle on. Breaking needles, this hit IPEDO or one of the Facebook groups recently. Somebody said they heard someone was breaking needles a lot. And I'm like, this is news to me. This is news to New Smile. We do not hear much about needles breaking. You really have to be very unkind to this device to break a needle. The needle is made to bend and long before it's going to break. The injection site, learning where you want to give this injection, you're going to, there's a learning curve with that. Different, like around the upper canine tuberosities, that bone's a little more dense. So you have to, be a little bit more patient in that area. And then the other thing I would tell you too is when we like to say we're going to be giving virtually painless injections. Well, I'm pretty sure when you were in dental school and you were giving your first infiltrations or inferior alveolar injections, they weren't virtually painless the first couple times because you didn't know what you were doing. So you are going to beat up some tissue. You are going to probably create some soreness in some of these first few patients. So just know that when you're calling your patients to check on them, they may say that. and getting a good grip on the device. This is super important for your tactile senses to really choke up on it and really feel what's happening. It'll really help you know how to reposition yourself before that needle starts to bend on you. I'm just going to show a few more examples here. Again, just showing like I can feel it bending, so I know I need to reposition my hand a little bit there. And again, I'm just trying to re-show you now that we've talked about it, like the grip that I have on it. I'm very close to where the action is happening. I'm tugging. I want to make sure I'm in there. I'm twisting. I'm being patient. And this was supposed to pop up, but this is the bite wing. This is actually my husband's assistant's son, Wyatt. And this is the bite wing that I used. And I looked and I was like, okay, I know I've got a good piece of bone right there that I can go in between the primary first and second molar right there. So that's how I chose my spot. But I could have gone distal to it. I could have gone mesial to it, and I still would have had profound anesthetic. Again, just showing another case. Oh, I think we already showed this one. I was just trying to show the x-rays here. So you'll see here, we don't have good bone distal to tooth A.
Good job. Put a nice and big for me, dude. You're doing amazing.
And we also have a massive abscess back there, but we do have good bone in between those teeth. Twisting, turning, helping it in. And here's another tip for you. If you're doing that and you're not getting anywhere, reposition. Just pull back a little bit, reposition. See if you can find another entry point. So I'm going to breeze through these videos here real quick. This is going to show you, so you've got 4 quadrants you're working in. I'm going to show you how you should sit when you're using these devices.
The important thing is like to get the patient in the position that is beneficial to you. So for this upper right side, I'm very close to my patient. I've got my elbows tucked in, I'm very close to my patient. So this would be for the upper right quadrant. And then for giving the injection, this is for part 2 of the injection. I'm going to go in like this. I'm going to go in like this. I'm going to go in like this. Good.
So the next one.
People say they really struggle with the upper left, and you've got to remember that you can move your patient. So I'll have my patient move to me. People say they really struggle to the lower left side now, depending on, you've got 2 options. You can either come in like this, stay on this left side, or you can roll around past 12 o'clock and come like this on this side, like this. It's really what your comfort level is. I like to stay on this side. My assistant's over here suctioning, so I try to stay on this side and just get a really high angle. So like this, or like this.
I think maybe we skipped a quad.
I say they really struggle with the upper left, and you've got to remember that you can move your patient. So I'll have my patient move to me like this. And again, I'm sitting very close to my patient. I'm not like way up here with my arms. I'm very close and have my patient in close. And then I'm holding the cheek back and retracting, and same angle. I would go in like this. I could go in like this. I could go in like this. To the lower left side now. Which is usually the easiest quadrant if you're just getting a sew-in. This would be the quadrant I would want to start practicing in. This is where we normally sit anyways when we work, and you're just holding the lip out, and again, this, and this.
So I hope you can appreciate in those videos, you're trying to stay at a very high angle, because the more you go into the peak of that bone in between those teeth, that bone is more cancellous in that area. That's what we're shooting for. So remind me again why I need this. Immediate action. It's going to numb the patient immediately. Predictable anesthesia. I mean, like I said, if you don't buy these things, if nothing else, get it for your hypoplastic 6-year-old molars. No delay between delivery and doing the treatment. You can do it right away. Much less stress, like much less stress. No post-operative side effects. Your patient's not going to be chewing on their lip. And you can optimize your appointments, right? You can decide, because this is another thing, people are resistant to things, right? And they'll be like, well, I'm gonna go and check recall. Okay, fine, go check recall. No one said you have to do the treatment as soon as you numb with these devices, but now you have options, right? Now, if you're behind schedule or you need to get that op turned over, get that treatment done. Don't change your gloves and go out and come back and do all that. Finish that treatment, and then that gives your team time to turn that rim over and get that rim ready for the next op that needs to be in that rim. So it just, it gives you another way to move the Jenga, pieces around the board is how I see it. And I mean, if, here where I live, like everybody has it. So it's not like something I can use as leverage as some marketing tool here, because so many people here have it, because I've rammed it down everyone's throat, because I think everybody should have it. But if you are like the person in your area that gets it, this is, I mean, what a great marketing tool, right? And then how often people who have it get parents that say all the time, oh, why doesn't my dentist have this? Well, it's only for kids. Sorry. Oh man, you can't use it on me. I mean, the parents are like mesmerized and blown away with it. And then I would tell you this, I'm an old fart, and if I can learn this technology, that's one thing. But this is Luke, our son, who is a D2 dental student and at MUSC, and this was Thanksgiving break. This is his brother right here. And I just noticed this, y'all. Blaine, who is filming this, is holding the bourbon and baby teeth. He's drinking out of that bourbon and baby teeth cup right there. So the reason I put this in here is like, have fun with this. Don't get your pants all bunched up your butt about it. You're going to make mistakes. You're going to bend some needles. There is a learning curve. We're all here to support you and help you. And if a freaking D2 dental student who hasn't even done a traditional injection yet can do this in our kitchen over Thanksgiving break, I'm pretty sure you can master this device. And this is another reason you do not need to give traditional injections anymore, because that's about what an inferior alveolar injection is like. So what do they cost? Again, nobody wants to be throwing money away. This is the true cost of the devices. You can take a screenshot of that if you want, but if you buy more than one at a time, the price does decrease. You can't buy one for a friend. You have to they have to be like in your office. But this is the pricing for the devices as it stands right now. I know New Smile's trying really hard to keep the pricing under $3,000 for all of us, while providing exceptional customer service and education and all the things, and keep improving the devices as well. But we have a sale. The SleeperOne, even though I have the Soan, a picture of the Soan right here, but the SleeperOne is on sale. You've probably seen it on iPedo. It's also in the Facebook group, but that is a very good price. And I don't know if you need to call your accountant and see, like, should you be buying, my accountant's telling me right now, like we're doing an addition on the office and I'm supposed to be buying a bunch of equipment and have it in use before the end of 2024. So, this week, they're all available to help you get these devices in your hands and in your office and in use. And you're probably not going to see this price again. And if you're like, oh, but I want the cordless one. Well, this is such a good price. Maybe buy this first. They're not that different. Maybe start with this one, especially if you're not sure if you're even going to take it out of the box. Don't waste the money. But this is like a really good price. I have not seen it this low, even in anywhere else. So I would encourage you to jump on that. And this is how you're going to learn to use the device, and this is who you're going to give your credit card to. but you're going to reach out to Chris. He can help you with training. This is his information. And then we have Jordan on here as well. I don't have a scathing photo of me and Jordan to use yet, but I'm going to get me one. And we're going to have a picture of me and Jordan on here eventually.
We've said that every time and we've yet to
I
take-
know it's going to happen. So these are your guys. And then we've got Erin, and she is amazing. And she is so patient, and she will walk you through the device and teach you how to use it from, from unboxing it all the way to using it on your first patient. So they're all here to support you and help you. And they want to see you be confident and, use these devices and get rid of your traditional syringes. And then Andrew Print, if you haven't seen his name all over, if you haven't seen him lecture, if you haven't joined the Facebook group yet, you need to. I'm going to pull that up here in a minute, but he is a wealth of knowledge. He trained me, he trained Larry, he trains doctors all over the country how to use these devices, and he believes very highly in them. This is when he came to our office a year ago now, just over a year ago, and trained myself and all of my doctors. And then he also trained all the doctors that live here, and then they all bought them. So we had a little stab lab situation, and we used them on each other. And like anything, that is, just like when you get a new dental material in your office or a new etch or a new varnish, you need to try it yourself. You need to know what you're subjecting your patients to. I encourage you to use this on each other, your dental assistant, let a colleague use it on you, so that you have a really good sense of what we're talking about here and the feelings that you feel when it's being used on yourself. But this is the user group. This is not for people who have the devices. This is for anybody who is curious about the devices, wants to learn more. And the thing I love the most about this group is no one's in this group posting anonymously. No one's in this group chatting on each other. Everyone is in there to help each other. People are so fast to post something that like went wrong, or they couldn't get right, or they need help with. And it is legit all about helping all of us get better using these devices. So definitely join this group, announce yourself in there. And then lastly, I just want to tell you that, the people that are using this aren't, I'm an early adopter. I'm somebody who goes out and buys things early and tries things, but I've got friends who aren't. Dr. Bobby Elliott, most of you on this call know him. He's a goat in this space, but he is like so risk averse and so like financially tight with everything, and getting him to let go of his wallet and get this was like excruciating for me. And then he used it, and this is what I got. And he sent this to me and Larry. I'm working at overtime today. I took out an upper right 4 on a 13-year-old. Then I did CNH on a 7-year-old. It's super easy. The parents are blown away. He has parents in the ops. So he's probably in there like, hey, I'm using this new device. And the parents are blown away. Thank you both for the exceptional education. And I just said, we love hearing that it's become a staple in your practice. Him and his business partner, Julie, that's all they use now. Brian Richard, he is one of my dearest friends. His wife is an orthodontist and is my best friend. We all went to dental school together, and he's a loudmouth on IPEDO as well as other places. Again, he didn't want to get it. He's riding off into the sunset. Why does he need this? He gives a good injection anyways, blah, blah, blah. Finally, and this is a true story, hand to God, I said, call Chris Malzone and give him your credit card and stop talking to me. So he got it, and then he texted, I just did my first case. It was a trauma case. These lower anteriors, couldn't even blow air on them. I injected between the teeth, a half a carpule of the septo, started right away. The kid never flinched for the beveling, the cleaning of the prep, any of it. He never felt a thing. Thanks, Anne, for selling me on this. We'll be curious how appointments go tomorrow. Well, Brian's a big rubber dam guy, uses rubber dam for everything. And the next day he sent another text, and he did like back-to-back pulps and crowns with a rubber dam on like a 4-year-old kid that didn't budge. Meredith Papadia, one of my dearest friends here in South Carolina, she didn't want to pull the trigger. She finally pulled the trigger. I think she either got it at SSPD or maybe she got it at AAPD, but she finally got it. She finally took it out of the box. And she said, I did it. I numbed at 10:13. I had the teeth out at 10:15. He didn't move. And I said, oh my God, please let me put this in my webinar tonight. We are so proud of you. And this is the home run for me right here. It was a huge rush. Like dentistry can be fun and new and exciting again. Cause y'all, when you've been doing it as long as some of us have been doing it, it's a haul, man. It can drag out and it can burn you out. And there have not been many things in my career that have come along that are like spicy again. And I would say it's you know, the dry vac is the one, or the isolite is the one. And this trumps it by miles. But these tools are something like we've never seen. I've never seen something like this as long as I've been practicing. Do you have a Stephanie on here tonight? Stephanie Weecham maybe is her name. Do you see her on here?
Let me check.
Stephanie Weechman. I want to know if she's on here. In the
She
meantime,
is.
Steph, I want to say hi to you. She's friends with Dr. Maria in my office. Steph, thanks so much for being on here tonight. She just got her device. She's an associate in her practice. I think her doctor bought it as a gift for everybody. I don't know, Santa Claus brought it. So really excited to see her unpack it and get to be able to use it in her practice. Stephanie, thanks for sticking with us tonight. As we end, we've got some exciting things coming up. We've got New Smile Tech is teaching a course in Fort Worth, February 23rd. Chris, do you want to unpack that a little bit and say what that whole weekend looks like?
Yeah. Sorry, had a
You're
different screen up. Yeah, so for the Fort Worth Restore course, it's a 2-day course. You have the first day on Saturday is restorative, and then Sunday, the second day, is a half day for tech. So full hands-on restorative and tech. We'll have a bunch of units there, give you a chance to practice, get it in your hands. It's for new users or prospective users. It's really for everybody. We'll be practicing on chicken bones, and you'll be leading the show.
Yes, it'll be fun. We'll be having a good time in Fort Worth. And then we have the Pearls course coming up. It's April 4th through 6th. It is for female dentists, and it is on like overall health, mental health, and physical health, and just how to be better versions of ourselves for our families and our patients. And I don't think that is sold out yet. I don't really even know. I don't
I
think
think
it is.
there's a few spots left.
Okay. And I will also be speaking at that. This sounds like the Ann Bynum show. I'm so sorry, y'all, if this is really weird, but I'm excited to go because I know who the other speakers are and I know what the other topics are. And I'm very excited to be at that. And also just to be with like-minded people who want to learn and want to be better and want to be better, wives and moms and doctors and owners and leaders and, better for our communities. I think it's a really great thing that New Smiles put together for us. And that is all I have. I just want to thank everybody for putting up with my technology BS at the beginning of this. That's what I get for getting a new computer and launching it on y'all tonight. But thank you for your patience, and thank you for participating tonight. One thing we'd like to end with is that, like Chris said, is that we're constantly evolving. That's what I love about New Smile. They're not, they get comfortable being uncomfortable, right? They want to see change for the better. And the only way they can do that is with feedback from all of us. So they want your feedback. If you call them, they are not going to see it as a complaint. They're going to see it as, this is feedback. This is how we can get better. And we want, your friends who don't have these devices yet, we want to know how you can tell us to give these webinars better so that they do want to buy them when the webinar is over and think, God, I do want to bring this to my community. I do want this inside of my practice. And if there's something we can do better to make that happen, please let us know that. This is how you can reach me. I am open for feedback as well. And I'm also open to help you one-on-one personally. I can help you with these devices. I can help you with your patient, your practice, I'm not marriage or kids. Don't talk to me about that. But, how to be an owner, an associate. I mean, I want to help you with anything that has to do with your professional life because I want to see you be better at it. So if you want to ever reach out to me, or if, you're just having a rough day, I want to be available to you for that as well. So thank you guys very much for tonight.
Awesome. Thanks, Ann. Appreciate it.
Absolutely.
Just want to reiterate the Q&A feature for questions. Please use that. We'll answer a few questions, as many as you guys have. This is your time, so utilize that. Also wanted to stress the onboarding and training process. I know Ann touched on that a little bit. We're here to help you guys, right? So we have a pretty extensive onboarding and training process that's an option to you guys. We do reward you for doing that with some free needles, but we have a 3-step process. It's a one-on-one call to help get your device set up, answer questions, go through basic features, settings, things like that. We have all of these webinars and previously recorded webinars that we do. The previously recorded webinars are posted on the website, so you guys can reference those anytime you want. And then we also have another survey where we're looking for feedback and how we can improve, because we don't want you to just get these devices and say good luck, right? We want you to be successful with them. And as Ann mentioned, there is a learning curve. So we're here to help. Just want to reiterate that. And unfortunately, if you do the onboarding, you're stuck with Jordan and Aaron. Sorry, guys, but you're stuck with working with them. But we'll give it a few minutes. Let's see if we can get some questions here. Again, this is your time, guys. So happy to answer as many questions as you have. Looks like we do.
I have one thing to say real quick, Chris.
Go ahead.
If you do onboarding with Aaron and I, we don't rub our eyes for 5 minutes to start.
Yeah. Thanks, Jordan. Let's see. Ann, you're responding to that? Okay, good. So give it a few more minutes, guys. If you guys have questions, please ask. Again, we're here to answer. But hopefully we'll see you guys at an upcoming workshop or event. All right, we got some questions. Ready? First question is, so the technique is the same between the two devices, just one is corded.
Yes, that's a great question. The technique is exactly the same. It's just that for some reason Dental High Tech chose to make 2 separate devices. They both work with a foot pedal. It's just one plugs in and one doesn't, and the one is less money.
Yeah, the sleeper one, like Ann mentioned, kind of the history there. It's these devices have been around for over 25 years, just not in the United States. So the sleeper one is actually sleeper one 5. It's in its 5th generation. So that is the original device. It's had 5 upgrades, 5 changes over the years. The Soan has been on the market for the entire world for the last 3.5 years. So that's kind of their latest and greatest with, again, from user feedback, they wanted a mobile option. And that's when Dental High Tech came up with that. Can you describe the onboarding in detail? Cost. So there's no cost for onboarding or training. Again, we're here to help as much as you need us. Calls, text, emails, majority of our day is spent answering those questions. So there's no cost for training or onboarding. But the specifics on the onboarding is it's a one-on-one video call with myself, Jordan, or Aaron, where we do a basic unboxing, answer questions, help you set up the device, go over some of those features and benefits. And then you have the option to watch a few webinars, previously recorded webinars, some training videos. There's a huge library on the New Smile website, so definitely check that out. But just again, wanted to reiterate there's no cost for that training. Next question is, do you still use topical prior to the initial injection?
That's a personal preference. I mentioned before that you can, like, if I know I've got a good patient, I know I've got a kid that's 10 years old, I worked on them 100 times, they're good. I don't use topical at all. I don't put a Q-tip in. I don't put any topical in there. I go straight in for my first injection. But if I'm trying to read the room and I'm trying to figure out, is this kid gonna, like, climb out of the chair, be a little sasshole, like, if I got to figure it out, I want to put a Q-tip at least in there and see what kind of reaction I'm going to get. So you can put topical on the Q-tip, or you can just put a dry Q-tip in there if you want. But the topical itself, you really don't need it. And I would tell you to, let someone give you an injection, or you give a couple adults that first injection and see if they tell you, oh, I felt that, or that didn't feel good. Once you get it down, you're not going to need the topical. But again, I still go in with a Q-tip on a kid that I just can't read the room on, and because I want their parent to also see, like, your kid's acting crazy with a Q-tip. So pretty much he's going to act really crazy when the handpiece starts. So no, you do not need it.
I think I can honestly say most of the users that I speak to, feedback that we get, there's especially in the beginning, they're still going to use topical. Part of that learning curve, as they get more comfortable, they may kind of shift away from that. But our recommendation is, obviously, we're not going to come in and tell you to throw away all your topical. But all right, next question. I may have missed it, but any absolute contraindications in patient history to using the Soan?
No, there was no contraindication to using the devices. You have to know your, know your medical history, as far as like your patient's medical history, as far as what types of anesthetics to use, or things like that. But as far as the devices themselves, no, there was no contraindication.
Another question here: is it easy to move between rooms of ops, or is it meant to stay in a single room? So I'm assuming that you're asking specifically about the SleeperOne. It is plug and play, so it plugs into the wall. We actually recently measured the length of the cords, so you have over 10 feet of cord to work with. But it is plug and play. Plug it into the wall, set it up on your delivery unit, and you can move it from room to room without a doubt. You just have to bring the cords with you. But on the Soan, you have the device and the foot pedal, and that's all you take from room to room.
I just wanted to add too on that the foot pedal for the Soan and the SleeperOne, it's both cordless, wireless, doesn't need to charge on both devices.
Yeah.
And all of your clinical controls are on the foot pedal for both devices as well. So they work the same way.
Great. And would you mind going back to the pricing slide?
I don't mind at all.
So the question was, what is the cost if I buy 2 Soan devices? So we do have bundled discounts on both units. So one unit has a certain price. You can see it there. Buy two units discounted, 3 units is discounted again. Same thing for the SleeperOne. The promotion on the SleeperOne right now through the end of the year is the 3-unit price. And if you're looking at multiple units for the SleeperOne at that discounted price, we can definitely come up and think of something creative to help you for getting multiple devices.
In a perfect world, I would, and I did this. I had 2 operatories. I bought 2 at once and kept 1 in each room. In a perfect, I knew I was committed, because I went to Andrew Prince's first lecture, and he showed a video of taking out front teeth on a kid immediately after numbing. And I was like, I'll figure this out. I want this, because that's just how I am. But in a perfect world, if you have 4 ops you do treatment in, I would buy 4 right out the gate. I would get your assistants. I would get everybody to be consistent and know all the things. Moving it to room is not fun. We loaned one of ours out when the demos were so hot. New Smile, they're still so hot, right? Like, it's so hard to get a demo from New Smile. And we had a local dentist who was on the demo list. And I said, bro, just come borrow one of mine for a week. We use it for a week. So he came and took one of mine, and we had to go back and forth and use 1 unit between both treatment rooms. And I wanted to jump off a cliff. Like, that was so not, the whole reason you have it is to be efficient. And I felt like this is so inefficient. I'm like picking up the pedal and picking up the thing and going to this room. And I don't know. I would tell you, like, if you're like me and you commit quick, like, just Just get them for all the rooms and you're going to get the discount. You're going to get the bulk price, you know, a better price anyways.
We have another question about the pedals specifically, if they're interchangeable, if you have more than one device.
You can answer, you can handle that one.
Yeah, so the pedals come pre-synced to the specific device. They're matching with serial numbers, so they do only work with their specific device. So if you do have multiple devices, quick fix, kind of an idea is to just number them, number one, number two, make sure that pedal stays with that unit. You don't want to be using a unit that's in the other room and accidentally injecting on somebody. So last thing I will mention, and then we'll give everybody their night back, but to Anne's point about the study club that she did, we are bringing that back for next year. New Smile Tech Roadshow, if you will. So if anybody has study clubs or colleagues in their area, large groups, myself and Dr. Andrew Prinn. So Andrew Prinn will be visiting the United States several times next year, and we'll be offering to do trainings around the country. So just if that's something that y'all are interested in, just let me know and send me an email, send me a text, whatever's easier, and we can start planning that for your study clubs for next year.
And the other part of that too is if it doesn't work out with your schedule to do it that way, you know, those of us that do these webinars, we're happy to be on your Zoom and do like a private one of these for you if you do a study club, which is super nice too.